Spend a little bit of time trying to talk about what Obamacare is up to. I think one of the first things I could ask is, and I don't want to spend too much time on this, but what do you think Obamacare is right now? And, okay, so hold that thought. The first thing I have to say is I find talking about Obamacare tremendously difficult, precisely because it is so complex. So what I understand is about this much of a gigantic thing. So that's number one. Number two is I've tried to give you guys, a fairly straightforward explanation of things as much as I can throughout the semester, and you simply are not going to be able to bullet point Obamacare as either something the left came up with or as something the right came up with. Okay, so that's I guess a beginning. What is Obamacare? What is it trying to do? What are its strengths? What are its weaknesses? Why is it good or why is it bad? Or we can talk about boiled peanuts.
Let's talk about boiled peanuts.
Come on in.
Boiled peanuts. I have no idea.
Personally, I know more about boiled peanuts. I mean,
Yeah.
I'm parents will say that I don't know about it.
But you work in, healthcare.
I don't build people. I mean, I just take care of it.
Evil people carry the building.
No, evil people don't build. A screwed up system is expensive, but evil people don't build. All right, well, that's actually kind of an important point right there. And keep in mind, I came out of pharma just 4 years ago, and I don't profess to understand Obamacare. Where's your mom from? Yeah.
Why?
She's too personal. She's like, that's too personal.
That's good.
She's not from around here.
Right?
No.
Everybody else was Ohio, Connecticut. All right, go ahead.
I was gonna say, I don't think anybody really knows anything, except for I know my mom's just getting out of the nursing program in 3 weeks. Or wait, that's
Go on.
whoa. And she just gets really pissed off about it. Because
Why?
it messes with the liability of her and her peers, and then it messes with her pay or something.
How?
I'm gonna go with words in the document.
Safe answer.
Say
Because no one really knows if it says that or not.
That's a very good non-answer. I like it. All right, go ahead.
The reason why I don't like Obamacare is because, the government already sucks at being the government. For example, you can talk to any military family and they'll tell you, what's it called? The military hospitals and stuff.
VA.
Yeah, the VA. The VA really sucks. That's a government-run facility. Another example is a few days ago, and the FDA is a government-run facility, and they shut down a cancer place that was all natural, so you didn't have to get the radiation and stuff because it wasn't FDA approved.
Yeah, there's actually a whole. Notice how what we talked about last time is going to actually be very tightly tied in with that. Okay, so you don't like it on principle.
Yeah. Because, the government hasn't been very good at doing most of anything, so why would they be good at running healthcare?
All right, that's a fair question.
Who'd you vote for?
Obama.
Did you really have to ask that?
Well, I was wondering if she voted, because she seems to hate government in
Well,
general.
hold on.
Oh.
Yeah,
So I was wondering if she voted or who she voted for.
I wasn't old enough to vote last time. Go ahead, Chris.
I was,
Be careful with what you say.
we have a listener.
I was actually going to say something actually
Okay, go ahead.
semi-controversial. I was going to say that I feel like I can't lean one way or the other because there's not enough information out there when it's there's something that they're trying to hide. They don't want to tell, I'm sure the information's somewhere, but there's so many rumors out there about what it does and what it doesn't do, and this, that, and the other.
Mm-hmm.
nobody really knows what it's about, so how can I mean, not that I can vote for it, I don't guess, but how can I say I agree with it or if I don't, when nobody really knows about it other than Obama and the people up in the White House?
Well, not even
Okay.
today, I read the entire document.
Yeah. My mom's a
Go ahead.
nurse, and she used to work at this health insurance place,
Mhm.
and they had classes on it, and they said that no one really knows because it's constantly changing. But the thing is, no matter if Obama won or not, Romney had a health care plan, which was the same exact thing. Like, both
Well-
sides are trying to build this healthcare thing up. It just
Well-
has different names on it.
I'm gonna have to take your word for that, because I don't know anything about Romney's
No, that's
idea.
true.
You never
of
heard of the
healthcare
Romney
plan.
plan?
One at a
It's
time.
a little different, but it was
That's
the
funny
same
coming from
thing.
you.
But they're both
Right.
talking and they like have the same pitch
Well,
voice.
How about this? I don't know what Romney was gonna propose. I don't, maybe you guys do. If you do, more power to you. But I do know Romney wrote Obamacare,
Yeah.
right? Because Obamacare is based on Massachusetts. And Massachusetts Care was enacted by Romney when Romney was governor. So you can start to immediately see how this ends up being kind of a hard thing to talk about. I think it would have actually been very challenging to be Romney and running, like if you think of this in terms of strategery. This is the original, I was for it before I was against it. But that's in a sense, that's neither here nor there, except insofar as this is something that Romney liked in another time and in another place. Okay? Now, how did a hardcore Republican get this through in ultra-liberal Massachusetts? It's kind of an interesting question to think about. Most of Massachusetts and Romney shouldn't really agree on anything. I'm actually not 100% sure how he ended up governor. Thank you. But, you know, that's Massachusetts' problem, not mine. Yes? Yes, magic, fairy dust.
There's a site that has all the points about what Obama is supposed to do. Like, not the talking points that everybody's doing, but like the
Mhm.
goals of whatever it is.
That's what I was just pulling out.
Yeah, that's what I did.
Ah, good, very cool. All right, so let me, because Obamacare ends up being so political so quickly, let's first try and look at what the left and the right might think. Because I actually find Obamacare to be deeply interesting. On the one hand, I don't know why anybody likes it. And that'll make sense in a moment. But let's see, left. If you think about what the left would want for healthcare, the left has a dream. I have a dream. And that dream is government healthcare. Meaning, you get sick, you go to a clinic, the doctor sees you, you get your antibiotics, and you go home, and you don't ever get a bill, because it's covered by taxpayer funding. This does not mean it's free. I don't think anybody is silly enough to think anything the government provides is free. Somebody's paying, we're all paying, that's what taxes are for. And their argument's going to be, we pay enough taxes, why aren't we getting some service like this? Which, in all fairness, is a legitimate question. The taxes are taxes, right? What are we getting for it? This is not what Obama built. Okay? Now, if we're going to go with a market answer to honor the right, let's say that the best answer that the right could come up with would be a cash system. Okay? Not even an insurance system, a cash system. Now, I have seen breakdowns on this that work out a number of interesting ways. One was from the 1950s that looked at what it cost to have a baby. All right? And in the 1950s, the health insurance system did not look like the system we have nowadays. So to a large extent, you were paying for having a baby, all right? And it cost, in today's dollars, something like about $2,000, all right? In today's dollars, you're getting closer for a contemporary delivery, closer to about 10. For that, you stayed in the hospital for a week. A week. Nowadays, assuming nothing went wrong, mom's going home in 24 hours. Okay? So somehow or other, since the 50s, it went from 2,000 and you stay a week to 10,000 and you're out in a day, right? Some of the reasons for that, now think about how much this matches up with our discussion on education. I mean, this has very much to do with how these markets actually work and what's incentivized. On the one hand, the 1950s neonatal ICU, if you had a problem, well, just say goodbye to the kid. What's that extra insurance worth? I don't know, you can decide, but it's expensive, okay? So there wasn't a contemporary neonatal ICU at your beck and call. Point number two, that room you were in was a shared room with a roommate, and it's not going to be beautiful, it's not going to be luxurious. And a lot of today's birthing hospitals are actually quite nice, bordering on luxury suites. And you can have water birth, and you can have midwives, you can do all sorts of choices, but all those choices end up being a part of the cost. If someone else is paying, like your insurance or like the government, there's no downward pressure to keep prices down. If you have to pay out of pocket, then you might only be able to afford $2,000. And that's what the market's going to have to be. For fairly well-to-do women that want privacy, somebody else can be the luxury provider, but it's not going to be the whole suite for everyone in town. In exactly the same way that, could you get a good liberal arts education for a few $1,000s? Yes. Do you get a Tajma gym and a lazy river and 14 new administrators and luxury apartments and, do I need to keep going? You see what's going on here? So because you're trying to sell to people and there's not necessarily this other money, you end up with amenity creep that ends up being kind of expensive. So hold that thought. So what the right's going to look for is a cash system. You'll pay for what you can afford. Since you know what you want and you know what your resources are, you can decide. If you want to go to the place in town that's got the best neonatal ICU and it's going to cost $3,000 at that hospital, if it's important to you, you can decide. If you really, really must have a private room, maybe that's going to cost you an extra $1,000, you can decide, right? But you get to decide how important these things are relatively. Go ahead, Chris.
I'm gonna ask a question. Like,
Okay.
this time now, there are certain places that won't take certain insurances.
Mm-hmm.
So do like private practice, doctor's offices, physicians, do they have the right to like, because I guess, I mean, is everybody gonna have to be on the system, or is it gonna be the people who need it or whatever? Because in that case, I could see where the hospitals and this kind of thing, as long as they're not public hospitals, like I guess the medical center maybe is public. I'm not sure. I'm just asking the question, can they deny, say, oh, we don't take that insurance? Because I've been to doctors before, oh, we don't take Blue Cross.
Mm-hmm.
So I'm wondering if they can or
Don't they
cannot.
have to pay a tax on it? If they deny
Yeah,
it?
so you guys are mixing up a couple of different things. And we'll get to this in a little bit. One, under the system, you have to have insurance. Just like under Obama's system, you have to have insurance. Just like in order to drive, you have to have car insurance. Okay? Except if you can't afford car insurance, you probably don't buy a car. Whereas
Or you just
you're going to have to have health insurance under his system. So that's point number one. If you don't buy the health insurance, you're going to get taxed and blah, 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 blah. Point number two, are people going to have the choice to choose which insurance companies they go with? Physicians going to be able to choose that? I would think so, but I wouldn't be surprised if that's something that evolves over time. Because one of the reasons that physicians work with different insurance groups is because they can negotiate different billing rates. They negotiate Well, let's just stick with that. They'll be able to negotiate different billing rates, and in so doing, that's part of the market working. Does that make sense? Go ahead, Billy.
In a caste system, what if you can't afford $2,000 for birth?
Then you have it at home in the lean-to kitchen. Right? Go ahead.
I just thought about this too when you were saying that. I know another thing with Obamacare is it's actually for owners and stuff, it's making them happen to make job cuts, which is making people lose their jobs, obviously, because they can't afford it in the employees.
It's
Yeah.
not making them, they don't wanna fork over more money, so
Well,
most of
there's a
them
couple
are
of things.
choosing.
That's actually a valid argument, and there has been some movement like that already. There are already people doing this. Now, there are also business owners who seem to really want to do as much as they can to create bad publicity for themselves and really make themselves look like tools and say, America, if you vote for Obamacare, I'm gonna lay off 12 people. So aside from the bad PR that comes from, if it costs more money, and I have $10,000 a month budgeted for employees, if my costs go up by 20%, then indeed I have to raise prices, assuming that doesn't affect my traffic, which it will, or I have to reduce what I'm spending. There is some truth to that. This is also the same argument behind the minimum wage. There are people that aren't really worth $7 an hour. Let's face it. I think the person that waited on me at Subway yesterday was worth about $4. Because that was how fast he went. Now, we don't like to say it, and the left likes the minimum wage. I respect that they do. But if I was running a business, there are people I might hire for $5 that I'm not going to hire for 10, right? And that's kind of the same argument there. So as soon as you put the minimum wage up, if this is my allocated budget for wages, then some of those 4s and 5s are going to have to get rolled into one big one. Does that make sense? Okay, go ahead.
What some business owners are doing because of it is they're giving people half the hours and hiring more people. That way no one's getting the full-time coverage and they're not having to pay insurance
Right.
for
And that's actually, Obamacare may have accelerated that, but this is also a thing that's been going on for about ever, right? Most of the university I've worked at, the secretary is a 32-hour-a-week employee, or they're 40 hours a week, but they're not employed during the summer. And what that does is makes them non-full-time people. As non-full-time people, we, the university, don't have to pay as many benefits. And you are right, when you start to look at American businesses over the last 15, 20 years, they have moved away from full-time people to part-time people. Recall our discussion about universities. You get rid of tenure faculty, the ones that sit around in their offices that you can actually stop in and talk to, but who also come with benefit costs, and replace them with term faculty, who you may or may not be able to get a hold of, but who you pay $3,000 per class, and that's that. There are no other associated costs. So that's a trend that's been happening in business and in the economy, and I believe this accelerated it somewhat. I mean, I think you're probably right. Go ahead.
You said that, brought up the point of the tax that you'll be charged if you have your home insurance, is that what you're saying?
If you don't get insurance.
Okay, so if you don't receive Obamacare, you're being taxed, is that what you're saying?
Well,
Everybody's taxed.
you have to buy Obamacare.
Okay, so you have to buy it no matter what.
You have to buy insurance. Obamacare is the law that says you have to buy insurance. I said it wrong at first. You have to buy insurance somewhere. It doesn't have to be from the government
Okay.
at all.
But you are getting taxed for a volunteer that pays for,
Well, because you're getting taxed already anyway.
yeah.
Because
well,
the way I understood it just now, you were saying, I recall that what was being said was that you're going to be taxed if you didn't receive the Obamacare. Because I think,
If you don't
is
have,
Obamacare a law?
what happens if you get pulled over and you don't have car insurance?
You get it.
Right. If I walk up, hi, I'm from the government. Show me your health insurance card. and you don't have one, then you're gonna get taxed. Is that gonna happen? No, but that's the idea. You have to have health insurance as a citizen of the United States. Where you get it is your business.
Okay.
The government may or may not be a part of that,
Okay.
but you have to go out and get health insurance. If you don't, you're neglecting your duties as a citizen, and I'm going to fine you, i.e. tax you. Does that make sense?
So
All right, now
basically,
there's a reason for that. Go ahead.
like, see, I'm just so confused, because I was wondering, because I was thinking to myself, well, the way I understood it before, I was thinking, is there a net to catch? Because if everybody gets Obamacare, then there's nobody paying tax, so therefore, there's no money. for it.
Everybody's paying Obamacare.
Well, I mean,
Yes.
that's- like, if you're just receiving Obamacare, the way I've understood it, if you're receiving Obamacare and nobody's
Okay.
being taxed, then there's no money going into the system.
Remember what I said, there's no reason for the left to like this? Obamacare is not Medicare for everyone.
So how does it-
Obamacare is a law.
So
It's
it's-
not the system.
So it's not the insurance itself.
No, it's the law that says you have to get insurance. This is why I think this is a little bit weird, and it is why it's confusing. But there's no reason for lefties to like this. This does not get anywhere close to a lefty political goal. All right? Keep that in mind. Lefties want Canada's system. They want Norway's system. They want Britain's system. They want any of the systems of our peer countries where you go in, you tell the doc you have an earache, he gives you drops, and you go home, and that's that. And this is not that. This is still our system. This is the system that you recognize. But the law is reorganizing how the pieces inside have to talk to each other. Okay? So you have to go get insurance just like your car insurance.
So you have to pay, so Obamacare is not publicly funded, you have to pay for it.
It's not publicly funded like this, no.
Right. But it is somewhat publicly funded by taxes. Is that correct?
There's nothing to fund.
I thought that
That's the point. It's not this.
okay.
That's a kicker.
So it's
For
not-
all of the hate the conservatives throw at this, and some of it deserved, it is not a public healthcare system. It is not a pension, it is not Medicare.
It's just more of a regulation of the current insurance companies.
There you go. So let's look at, so our insurance system, our current healthcare system is really strange. There's no other way to say it. Now, one of the first things that Obamacare is going to try and do is address this central problem. Let's talk about the business of insurance, okay? We started on this a little bit before, and I don't care how much Sarah destroys her phone. If you can self-insure, it always makes more sense to self-insure. What do I mean by that? If you buy auto insurance from the day you're 16 till the day you're 66, that's 50 years. Over the course of 50 years, you're going to have a couple of accidents. Maybe you're going to total a couple of cars. Hopefully you don't cause any lawsuits. That's going to cost a certain amount of money, right? The problem is you can't afford to go buy a $30,000 car and then the next day total it. So you buy insurance so that the day after you total, when you total that $30,000 car, the day after you buy it, you don't have to come up with another $30,000, right? And any legal costs that go along with that. Out of that course of your life, you've paid in, and that risk has been spread out over the course of your life. Now, we can talk about this as one individual living a long time, or we can talk about 1,000 individuals all right next to each other. But if you have 1,000 individuals and you have some basic demographic information, you can predict what their car crashes are most likely going to cost for a given year. Okay? The insurance company takes that pool, estimates what that cost is going to be, and divides out what they collect out of that whole group of people. And they have to charge an administration fee because it doesn't do it itself, and because they're businesses, profit has to come out of there too. Which is why I say, if you can't afford to do it, unless you are tremendously unlucky, it's better to self-insure. Because you don't have to pay the administration fees, and you don't have to pay the profit, right? You just keep your own money in the bank. Now, what's that going to cost? If you were actually, if you're talking about cars, you're not allowed to self-insure unless you've got something like $1 million you can set aside in an account that covers everything your Geico insurance covers, right? Your liability, your full roof placement, whatever. If you think about your electronics, if I go out and I buy a $500 TV and I plug it in, and at the end of the year, when the warranty runs out, the day after it dies, that's going to cost me another $500 to replace it, right? And so Best Buy says, you should buy our TV warranty, right? Our insurance. And they charge me $50 for it. Now, if you can't afford to replace that TV, then now insurance is a good idea because it might die. But when you think about how much electronics you buy in today's world, which is a phone every couple of years, a laptop every couple of years, a TV for you, a TV for the kids, iPods, I don't know, GPSs for the car, whatever. We buy so many electronics in today's world that if you were to buy the insurance on all of them, it's going to cost you more than simply replacing the devices that fail. You'll notice there's also an argument there for buying a little bit less than the most expensive thing you can afford is, right? Now, how do we know that this is true? Because insurance companies exist. They don't exist out of the goodness of their heart. They exist because they can estimate that and make a profit by charging more than it actually costs. You just simply can't afford to do that to your big purchases. If your house gets destroyed by a tornado, you don't have another $100,000 to go build a new house. So you buy house insurance. If your car gets totaled and you cause somebody $1 million worth of medical damage, I don't have $1 million for medical and $30,000 for a new car sitting in the bank, so I buy insurance. Okay? Quick.
This is gonna be a crazy question. So why do you have to have car insurance and home insurance? Because if your car's an extension of your house and it's covered, like if it gets damaged during a storm or something, it's my understanding that housing insurance covers.
Different companies can be more on top of the different actuarial risks involved. So if you buy car insurance, first of all, car insurance laws are different in every state, right? Second of all, they're going to want to know how old you are, what your driving record looks like, what kind of car you're driving, and they're very, very on top of the current data for who does what stupid things with their vehicles. And that's a very different data set and a very fine-grained information that, like I said, is different from housing, right? So every area is different. Some places you get blown away by tornadoes, other places you get sucked up by collapsing coal lines. Some places you have wildfires. That's a different data set. And so you've got different kinds of actuaries working on the different things. But the truth is, most big insurance companies will offer home and auto, sometimes health, or life insurance certainly. Like you can get those separate products from the same company if you so care to. Okay, so I'm an insurance company. Here's a population. Out of this population, I'm going to insure this many people. In order to improve my financial well-being, because I'm an insurance company and my job is to make money, there are two things I can do to improve this ratio. I can increase the amount of money coming in, or I can decrease the amount of money going out. An easy way to increase the amount of money coming in is to sell insurance to young people, right? So instead of here, I'll move my bracket up to here. The reason we want to insure young people is because there are only really two things you need to worry about. The women are going to get pregnant, and the men are going to do stupid things and end up in the ER for stitches. That's it. Young people are pretty predictable. And if you have 100 young women, you can guess what percentage of them are going to get pregnant. And if you have 100 young men, you can guess what percentage of them are going to get drunk and crash their bikes and need stitches. Right? It's a straightforward calculation. So the more healthy people I can bring in, I can collect premiums, but I don't have to pay out very much. Right? Part of the problem for insurance companies is young people know that there aren't really any costs, and so they say, I don't want to be a part of the insurance. I don't need to buy insurance. I will do my best to not get pregnant. I will try and not get drunk and crash my bike and need stitches. Right? So if you are 20 years old and you live your life with a modicum of caution, your chances of being healthy are pretty good. You don't actually need insurance. So this is a challenge, but it's one way to increase their bottom line. The other way to increase their bottom line is to, let's put the little star here, is to ditch the old and the decrepit. Okay? So whereas if you take a class full of 20-year-olds, a pool of 20-year-olds, and your biggest concern is getting drunk and getting knocked up, and then you take the same size pool of 60-year-olds, maybe the same people 40 years later, you're going to have obesity, you're going to have diabetes, you're going to have high blood pressure, you're going to have blood thinners for stroke, you're going to have heart attacks, you're going to have blown joints that need surgery, you're going to have childbirths that didn't go well and require surgery, you're going, not at 60, but maybe maintenance stuff, right? There's a lot that goes wrong. There's a lot that goes wrong. And those people are expensive, okay? So one of the best things you can do if you're an insurance company is to ditch the old and the decrepit, the expensive. So this creates a tremendous problem if you care about people's health, or if you pretend to care about people's health. The people that most need insurance don't have it. And they're not going to be able to get it. So here's a true story. I worked at this place where, I worked for this company where one of the benefits was as you, after you retired, you and your spouse can stay on the company healthcare plan. And they said, I know that our wages are a little bit low. They've been a little bit low for 2 decades because it's so important that we provide this for our retirees. Okay? Sounds awesome. The head HR guy's wife herself had multiple sclerosis. She was not insurable, but because it was a work healthcare plan, she was on the plan, and that was that. Okay? Well, of course, the year after I got there, they said, yeah, we're changing that. And the awesome irony was that the guy who was going to be most hurt in the company, the HR guy whose wife had multiple sclerosis, was the one in charge of helping everyone understand what this actually meant. Go ahead.
Did the wages go up?
No. Are you kidding? Not only did the wages not go up, but when you looked at this guy, and he was only 50, like he was at that stuck age. In fact, a lot of my friends there were about 50, and none of them were happy about it, because they just saw their entire post-retirement income drop by $10,000, because now you're going to have to buy insurance on the open market, first of all. Second of all, this guy in particular, you could see his financial future. He was going to retire. Her medical costs are going to, in about 2 years, completely wipe out their savings, at which point they're going to be poor enough for Medicare and Medicaid. And if it was my wife with multiple sclerosis, I'm not 100% sure I would be satisfied with Medicaid level care. But that's me. Does that make sense? And so, what a terrible thing, right? So, poor people with terrible problems is something that aggravates the left. So one of the rules is you can't ditch unemployable people, uninsurable people. So now, if you're offering insurance, you have to sell it to these guys too. This creates a huge problem. So the left loves this. Notice it's not single-payer health system, it's just coverage for sick people, expensive people. Now, these guys are going to face a problem because what you just did jacked their costs through the roof. Faster than a meathead on steroids. So, the other part of this law, the one that you guys started talking about, says we're going to make sure that everybody has to buy insurance. Now, maybe my slider was a little bit off, because I just made it up. But this is an expensive group of people, and we got to make sure that somehow they're covered. Because of this, you may well see costs across the board go up because we're covering the expensive people. I don't know, maybe, maybe not, but it's certainly a possibility. So number one is we're getting everybody in the pool. And that should make sense. If you think about the business owners you know, or people who are in charge of buying, if you have a small company, only 100 people, and you got to buy a policy for that 100 people, that's a pretty small pool. If you've got one person with an infected diabetic foot wound, you're going to affect the rates for everybody in that 100-person pool. And essentially, what this does, if not for the individual insurance company, at least for the insurance industry, you've put everybody in the pool. And so that will bring down the cost of those extreme events, because it'll be distributed amongst everybody. Is that clear? Okay, point number two. I'll just put this here. All right. Number two, if you recall from our talk last time on Tuesday, the only downward pressure in the healthcare system that exists now is from the insurance companies, right? The doctor, he chooses what procedure you're going to get. He chooses what drug you're going to get. All the marketing is done to them. He or she chooses what test you're going to take. And they're not worried about the cost. Fair enough, they care about your health, hopefully. You have to pay for the drugs, but you only sort of pay for the drugs and the procedures and the tests, right? You pay whatever the insurance company tells you to pay, which is a copay, which is a fraction of what these things cost. Your big healthcare spend isn't for this month's copay. Your big healthcare spend is the maybe $8,000 you spend on health insurance for your family. So when you look at that $8,000 bill you sent off coming out of your paycheck, you say to yourself, I spent $8,000 on this. I deserve the branded medication. I don't want generics for $4. I don't care if the copay is $15. I'm willing to pay the $15 copay to get the $200 branded drug. I don't care if the generic is $10. However, the insurance company over here, the insurance company does care about that extra $150 of theirs you just spent. So they're going to try and push you into doing something else. They're going to try and negotiate with the pharmacy to get lower. They do all sorts of things to try and bring down their costs. You don't like any of them because you already spent an arm and a leg and you think you deserve the good stuff. So remember, this market is not straightforward, transparent, with equal pricing and demand going back and forth. You've got a market that's flailing. I like it. All these different pieces everywhere, like a squid. Okay, so the insurance companies are the ones who right now are trying to keep the prices down, right? So now that we got everybody into the system, let's encourage these guys to compete with each other. Because if they're competing with each other, and their job is to keep prices down, then the fact that they're trying to compete for cheaper and cheaper business means that hopefully they're going to be able to push that healthcare spend even lower, right? Now, there are a couple of problems with insurance companies competing right now. The first is, even though it's a private system, as a consumer, you don't have as much choice as some people might say you do. I don't know about you, but every time I get a job, I get the insurance. Period. I might have a couple of choices that my employer has given me, but I'm not choosing on an open market. I'm choosing between 2 or 3 tops. If I don't like the insurance my employer offers, I'm free to not get it, and then I have to go buy it on the open market. But once I leave, and this is a great example, once I leave the pool of University of Georgia UGS employees, which is several thousand, if not several tens of thousands, I'm a singular person buying in this market instead of a part of that huge pool. I'm going to get much better prices here, which is good. But what it means is when we start talking about market choice, in fact, I have 2 or 3 choices tops. Okay? So it looks like a private system, and it is a private system, but in terms of that transparency of market with demand and service and prices, working to clear it out and get everybody served, it's a very circuitous thing. So, I've never heard anybody say it, but I am about 88% positive that one of the goals behind this is to get your job and your healthcare taken apart. And this may cause a lot of disruption while it happens. It may not even work. But once your job and your healthcare are taken apart, then you can actually choose among all of the choices that you want. There will be no special benefit from staying within the University of Georgia system, and there won't necessarily be a penalty for buying on the open market, like right now I buy my car insurance. Does that make sense? Okay. So, number one, if you can break your health insurance off of your employment, now there should be some good benefits to this. I've heard a lot of business owners complain heartily about the fact that they have to provide insurance as part of their employment plan. In many cases, it's the most expensive thing. It's growing the most quickly. It's a big detriment to jumping from I'm small enough that I have 5 people that nobody's insured to now I have 25 and I have to buy something. It's a huge reason people won't actually try and start their own company or leave a job they don't like, right? This system that we have now, in conservative terms, is slowing down liquidity in the employment market and entrepreneurship. I have heard small business owners argue for the lefty system just so they could get away from having to provide it as an employer. They want to sell elevators, they want to build cars, they want to consult businesses, they don't want to muck around in insurance plans. Does that make sense? Whether it works, I don't know, but that's one of the outcomes they're hoping for. Chris?
This plays back into something I mentioned earlier in the semester about the Cadillac insurance.
Mm-hmm.
Like, that definitely is one of confirming evidence points of they're trying to separate employment and health insurance.
Yeah.
Like, I don't understand why, but that's what I want to get at, is why they want to do that, because right now, there are plenty of people that work at said grocery stores that work there not because of the pay, that's for sure. They work there because they provide good insurance.
Right. But if a grocery store, for instance, you could argue this from both ways. On the one hand, if you're a business owner, if I'm running a grocery, that health plan cost me a lot of money. Maybe I'm good at negotiating, maybe I'm part of, like the groceries, many brands are owned by the same big companies, so maybe they're buying as a whole. But even so, that means every single employee I gotta pay health insurance for too. So you should theoretically see quite a raise if those two things were broken apart, if that makes sense.
I mean,
You should.
the only reason I don't understand it is, well, at least in the example of this grocery store, is that 90% of the people that work at this place are still living at home, making minimum wage. They don't need the insurance, so they're not taking 90% of the people. Only the people who are in college and older are taking, but that's not the majority of people working.
There'll still be a little bit of a savings. And maybe they don't care. I mean, that's the other thing, is it isn't necessarily going to affect everybody. Like, here's the thing. I've heard, and it's been a while, and it's going to vary industry to industry, but I've heard business owners say, if I'm going to pay a $50,000 wage, that's actually a $100,000 employee because of the hidden costs. Part of that's the taxes that they gotta kick into, but part of that's the cost of that extra insurance plan. So a grocery store that can offload all of that cost is gone. Now, here's another thing. Think about the Cadillac insurance plan. If you're working for Google or Microsoft or one of these defense contractors around here, you may have a health insurance plan that's more than gold-plated. And that's great if you're well enough to do that. That's the kind of job you're able to get. If, however, the best you can do is a minimum wage grocery store job, you may find that if you're working for the wrong employer, your only option is no insurance or bad insurance. Think of the minimum wage people that are out there right now. If that's the case, you've only got this bad insurance option because that's the cheapest thing that your employer is going to get. Because, face it, you're only worth $5 an hour to them anyway. So they're not going to spend extra on a good insurance plan. You're not at Microsoft and Google. If that's the case, it wouldn't matter if your rich aunt died and gifted you $100,000, you're still stuck with that crappy insurance plan. However, if you were to break the two apart, and this is entirely hypothetical because I can tell you exactly what will happen, but this is the argument. If you were to break the two apart, this guy may only be able to afford the kind of insurance that a $5 an hour employee can afford. But if his rich aunt died and left him $100,000, he could buy a few years of really good insurance, right? The end result is going to be that poor people still have crappy insurance because that's life. If you learned one thing in sociology class, don't be poor. Go ahead, Jamie.
I know, like, I work at O'Charlie's and they actually give us insurance. And there's a bartender there, and the insurance that O'Charlie's has, her son has diabetes, and they want to insure him because he had a pre-existing condition. But for Medicare and stuff, and remember, she is a server, so on paper, she's not making that much money. Because, you know, servers usually don't claim their tips.
And even with their hidden tips, we're not talking a millionaire here.
Yeah, it's not that much money. And, but for Medicare, she made too much money. So she was stuck in between not being insured for her son who has to have insulin and stuff. And I don't have diabetes, but I'm sure it's expensive. And making too much money. And pretty much she said, like, the only way she would make enough money is for her to be unemployed. So it's kind of like the system wants us to not work.
It's a...
Yeah, I feel like that's the main argument from the right is that, oh, the government wants us to be reliable. And that's the one that I hear. I'm not saying that's mine. I'm saying that's the argument that a lot of people make. Is
That the government-
this is socialist, blah, 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 blah.
Yeah, but what I'm trying to show you is, in direct terms, this is actually not socialist. Now, if you don't like the government, there's plenty to dislike here. And that's where the this is socialism argument comes from. And I can talk to that in sort of a minute. But the second thing that's going to be important about this is getting the insurance companies. So every state has to create a market exchange, right? And part of what that is going to do is allow the insurance companies to cross state boundaries more easily. It'll also, well, there we go. It's going to allow insurance companies to cross state boundaries more easily, and in so doing, you'll have more insurance providers fighting for your business. Because we said everybody has to be in it, we have more people in the business. So if you believe in markets, theoretically what this is supposed to do is get more people into the system, get more providers into the system, and to have those providers compete for that larger share of business. In so doing, we should see, if you believe in markets, we should see quality come up and prices go down. Okay? So I wanted to get these two things out there. If we can break health insurance from employment, and if we can get more insurance companies competing with each other, you'll see prices go down and quality go up. The reason that I want to point this out is this is the fundamental nugget of conservative belief. If you're a conservative, you believe in markets. So, how did the Republican contender for president get this passed in Massachusetts? You actually have your answer right here. In making sure that everyone's in the pool so that the diabetic kid can get his insulin, you make the left happy. In using the engine of markets to keep the prices down and reward incentive and reward business, you keep the conservatives happy. That's why Obama can pass this. After a very contentious and hotly political debate, he passed it because this has key elements of both sides in it. This could be why it works. It could be also why it fails, right? I mean, both of these systems can work. Maybe, maybe not. I don't know. I'm not placing bets. I want to wait and see how this plays out. Go ahead.
I just, like, to me, I don't understand why either would ever, like, it's like you said, because, I mean, to me, like, we already have a problem with unemployment, so if the insurance is not provided by the job, a lot of people are gonna quit, then they're not gonna be able to find jobs. So they're not gonna go back to that one, that's for sure, because they're not getting the insurance, what's the point of working minimum wage now? You know,
What makes you think people are gonna quit just because they don't have insurance?
heck, I would, if they were paying for my school right now, I wouldn't be working for it, I can guarantee that.
Kroger
Well-
pays for your school.
Yeah. they do.
Really?
Yes.
Okay,
You just
But-
got to have to new application.
do you have other bills?
What happened with that?
You don't have the bills, so you have the luxury to quit, but I mean, it's like you're under the impression that more people work for benefits as opposed to work out of necessity to live.
That's why my dad works for me, works because they have good insurance.
Well, I mean, you're saying,
But he still works somewhere.
yeah, he still works somewhere because he has bills to pay.
Right.
But
Yeah.
if no one was paying insurance, then that aspect would be taken out. I mean, everybody still has to, at some point, work. So people aren't just gonna quit because, and I mean, all I'm saying is, if it's across the board where no one's paying insurance, then that idea, well, they're not paying insurance, so I'm gonna quit, just kind of goes out the window as well. I mean, unless they just wanna be
I mean,
homeless.
I just don't see why they need to do that, because, I mean, if they're providing insurance, okay, what's the big deal? That's nice, that's a great thing.
Mhm.
Why in the world would I want to have to pay for someone else?
Because you're still paying for it either way.
Yeah, they're paying for insurance. It's
I mean, yes, but,
and they're paying for insurance.
There's
So
only-
there's like 2 or 3 things going on in what you're saying. Okay. The first is a general economic question. So if people aren't getting insurance and they quit, then what happens? How you answer that is going to depend on how you vote. Because there are many people that say, these guys say, government messing around with things, blah, 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 causes a problem. If people start quitting and companies have to pay more to get them to work, then the wages are going to go up and that's going to be fine, right? If, if you got rid of the minimum wage, then more people will get jobs, even if they weren't great. So that would balance itself out. That's going to be that argument. The second argument, or the second point, if they want to keep providing that benefit, they absolutely can. And that's how you'll get your health insurance, and you're happy with that, right? No, you're not penalized at all. You got your insurance through them,
I'm not, but like,
but if they,
we talk about the Cadillac insurance, I mean, they will be penalized for having good insurance provided from the work.
no, there won't be, no, they're not gonna be penalized. So here's why I'm saying this, right? And this is the problem with this debate, this whole discussion. Not you, and not this discussion, but the discussion about Obamacare.
You specifically.
It sometimes is Chris. It's that, here's what happens, here are some of the follow-on effects. By the time you're on to follow-on effect number 3, you're starting to speak pretty hypothetically. And a lot of the debate, the partisan debate, is based off of secondary or tertiary follow-on effects. So here's how that argument's going to go. How the argument's going to go. How reality goes is anybody's guess. But the argument's going to be, they have an awesome plan that they negotiated with, and isn't that great? It's something they can offer their awesome employees because they love their employees. Okay? So 2014 passes, they keep offering that awesome plan, right? Meanwhile, other companies are saying, oh, this is changing, I don't want to spend that extra money, I'm going to divest myself of that and leave my employees go, right? So their employees have to buy it on the open market, others have to buy it on the open market. If you get that cascading of companies dumping their insurance plans, then it doesn't matter how good a deal these guys made to get this, it doesn't matter how much they love their employees, these guys are paying $50,000 for their employees, these guys are paying $50,000 plus insurance. So when they say they're going to be penalized for it, Obama's not coming out there with a ticket, here, you can't get offer good insurance at all. They can offer as good insurance as they want. And you bet that if you're working at Microsoft and Google, or any of the big prestigious companies that have plenty of money, you're still going to have that kind of insurance. What that means for the minimum wage grocery worker, however, is as this progresses, their company likely, like the company that I was working for, will likely say, this isn't a benefit we want to continue providing. So that's what that means. Even though that's not exactly, you have to recognize that there's a chain of events that leads to that sort of argument. All right, Jamie?
I think one of the problems is though, is, you know, we already have a problem with unemployment, and let's just be honest, there's some people out there that just want to mooch off the system. And poor people are, not really poor people, but minorities and all that stuff, they're usually more unhealthy than, you know, rich people, as bad as that sounds. So it's like they're paying less, the rich people are paying more, but the rich people are also paying for their bad eating habits, which causes, you know, heart disease, diabetes, smoking, drug use.
You're already paying for that. Here's the thing that I don't understand why.
I'm not saying all rich people don't do drugs and stuff.
That's okay. You're just trying to get me fired. I see what you're saying. I don't know what it is about you people and the inflammatory things you say. I truly don't understand the South. If we're not allowed to talk about these things, why do you keep bringing them up? That said, I don't know why conservatives love insurance unless they actually work in insurance and are driving Beamers. Do you know what insurance is? Insurance is socialism that's properly paid for. Think about that. You are already paying whatever insurance plan you're on. Okay? I'm paying for the fat ass down the hall from me. Right? I try and eat right. I try and work out. I try and keep my kids healthy. And I look down the hall and here's one heart attack after another. And I'm paying for them, right? A person wouldn't know a piece of gym equipment if it fell on their head. And I'm in the same pool that they are. So I'm not paying for the Medicare problem because somebody else is paying for that pool, but I am paying for all the really stupid decisions of people that I'm working with. Right? They want to stop outside and have a smoke? Thanks, here's a quarter. Right? Because I'm contributing to paying the price prices for his and her bad decisions. That's what insurance is. And if I, in pursuing my health, save any money, it doesn't benefit me, right? It benefits the guy driving the BMW, and it benefits the walking heart attack over here. I'm being a little bit facetious, but I mean, it's a university, we're all in the same system. Look around. I mean, that's what it is, right? And so you're already paying for that. I think you need to absolutely recognize that, because you're paying for it no matter what. If you have a government system, you're paying for government-funded poor. If you have a private system, you're paying for, and let's face it, when I'm in super high-speed industry, you know what I'm paying for then? I'm paying for type A heart attack. And I'm paying for, Mr. I eat nothing but airplane food, triglycerides heart attack. And I'm paying for, I never leave my computer, and I've got terrible posture, you name it, I'm paying for it, because that's what it is. That's by very definition what it is. And furthermore, you never, ever, ever, ever want to win the insurance game. Because if you won the insurance game, it's because you had brain cancer. There are a few things which are going to cost so much money, you actually get a positive return on your insurance investment. Believe you me, you don't want to win. And that's just a fact. I mean, that's the business, and that's why I spend this much time trying to talk about it. Go ahead, Curtis.
Went to pick up a little girl's pills one day from the pharmacy, and City of Warner Robins has great insurance. And that is the reason a lot of officers have stayed there all those years, because it makes a difference in the end of your daily life, how much insurance you gotta pay, and it's compared to your paycheck. And once you have a family, you're not gonna let your little girl go without her epilepsy medicine. That's what she needs to keep from having seizures. That was $1,700 a month that the city paid for a matter of 2 years. It cost me $15 a month. It will pay off in the long run. How their insurance system's going to work, I don't know. I personally think that the socialist system of providing medical care would work if the military would, if the government would do it properly and use their people to do it with, as opposed to sending it here to the insurance companies for somebody to make profit on. But that's just like my father-in-law worked on the base for 20 years, painted the buildings on the base, ran the paint company. He could paint a building for 20% of what they contracted to have that building painted for. And they continuously cut his crew down until it was like 7 and hired everything out. They just throw money away. But if they wanted to do it themselves, they could do it economically and would save all of us a lot of money.
Yeah, I have to 100% agree with Mr. Strong. I think it's entertaining, and my anti-political red flags go up every time I hear somebody say privatize, 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 privatize. It's not that privatization is necessarily bad. However, somehow or other, the way we do it is we farm it out and it ends up costing more than ever, right? You've got scads and scads and scads of airmen and women living in this town, and the nicest houses belong to the contractors? How does that work?
I have a friend that's a contractor. He was the 3rd contractor on a base job because the other 2 were minorities, and they hired him to do the work. He and his group ended up finishing the building they couldn't finish, and he made a lot of money. They made a lot of money off of him, and they didn't even walk into the building.
Yeah, and now, so here's the thing. If I were a diehard conservative, then I would say this cannot work. In my mind, and this is, I try to not be ism anything, whatever flavor. When I look at most of the European countries, their systems work. If you listen to our Republicans, their systems are a nightmare. But if you go talk to French people, and you go talk to Canadians, and you talk to the Icelanders, and you talk to the Germans, they're okay with their systems. It can be done well. Whether we can do it well, I'm not 100% sure, but it can be done well, right? So here's a, okay, quick.
I was
Well,
just
go
gonna
ahead.
say, their culture is also very different from ours. Their culture, like, you mentioned it before, like that village or whatever, where everybody helps each other out.
Mhm.
If you asked Americans to do that, you'd get like a fifth of our population who would be willing to help out.
Well, yeah, but I'm okay with that.
I'm just saying, like, our culture is designed to where we're very selfish. And so asking, like,
Yeah, again, I don't really have a problem with that. We're individualistic, and that's the way the Americans are. I'm not sure that that's a huge problem. The problem is, whenever we seem to build something even remotely like this, it gets perverted pretty quickly. It's entirely possible the only people that are going to benefit from this are insurance companies. It's entirely possible that this could drive insurance companies broke. I could see both of these things being true. If this is actually going to bring down prices, it's going to be because the insurance companies actually did it. And they haven't done a great job of keeping prices down already, right? I'm positive that a cash system would work. And in fact, there are already, and this just came up on the news actually, but you saw it?
No.
Okay. There's a surgical center in the Southwest somewhere. If you Google it up, you'll be able to find it. They actually have cash prices. So you need your rotator cuff done. It's going to be $26.85. You need an arthroscope on your knee. It's going to be $3,500. You need, whatever they call it when they release the pressure on your neck because you're old. That it's all covered, right? And the prices are not what your insurance company is paying, or at least not what your insurance company looks like it's paying on paper. There's another guy, and this is funny. So India's got 1 billion people, and their public system apparently is a disaster, an absolute failure. A public system is not guaranteed to work. It's so bad it covers like 4% of people, according to this article. So consequently, India has evolved a Walmart approach to surgery, such that, yes, your bypass can be done for less than $5,000. But it's not happening in a private room with a beautiful hospital. It's happening in a pretty bare-bones surgical center by a physician that does bypass after bypass after bypass. That's what he does. And the place runs, and the air conditioning's not really cold. But it's sterile, it gets the job done, and it's doing it cheap. Now, do I want an Indian healthcare system? No. Do we do things better here? Absolutely. But the larger point is, if you really needed a bypass, I'm pretty sure you could come up with $5,000 to cover it. If it meant you had good anesthesia, good post-op care. I'm pretty sure you don't need, and I'm pretty sure you would find, because it's that important, it would work, right? Now, if you really cut your fingers off, like I love that example from the Michael Moore movie, at work, and you got a, part of a cash system might be saying, I'd rather not have my fingers, as opposed to, yeah, put $3,000 on my credit card. But that's part of the cash system. I know both could work. Somehow or other, when we put them together, though, we create very strange systems. What this is on the board, one of the dangers I see with this is when you start bracketing off, and this is going to be a fairly conservative sounding critique. When the government says, okay, you have to cover these people, and you have to cover these people, and you have to cover these people, and you have to cover these people, you're building, in statistics, we would call this degrees of freedom. Somebody taking statistics this month? So degrees of freedom, when you have an equation, and you got a lot of variables, there's room for all those different numbers to float. As you start nailing down variables, you start running out of degrees of freedom or room for that equation to move. It's exactly like trying to park your pickup in a parking lot. When you pull into the Walmart parking lot at midnight, there's a million spaces you can park wherever you want. When you pull into the small parking lot at 2 in the afternoon and everyone's there, you don't got a ton of room, okay? I see how this could matter for what these guys are doing. So we can't get rid of the diabetic kid, right? We can't dump grandpa because he's got, already had a heart attack. We can't, and we can't, and we can't, and we can't. Those are the curves that are set on this. Now, when it comes on this parking lot, these are the parameters that are set by the law. Now, secondly, a part of the law says you are only allowed to use 15% for administrative costs. So that 85% has to actually be spent on coverage. It sounds great, but if you believe in free markets and if you believe in room for business to move, you've actually just cluttered up most of this guy's parking lot. You said how big the parking lot is allowed to be, and you filled up 85% of the spaces with other cars. Now, I could very quickly envision a world where someone says, okay, the next thing is we need to make sure this is covered. And we need to make sure that this is covered. Look at how this works out in civil rights legislation. Everybody thinks everyone should have equal coverage, equal opportunity before the law. Duh, this is 2010. I don't care what you guys say. Oh, wait a minute, I'm behind. It's 2013. And everybody thinks women should have equal opportunity, I mean, there's no one thinks anybody should get paid differently, have different rules in today's world, right? Very clearly, the right thing to do in 1960. Since then, somebody said, you know what? It sucks that we're so mean to guys in wheelchairs. So we should have the ADA. And it sucks that, what came after that? It sucks that we're mean to gay people. So we're going to include that. And it sucks that every time something blows up, people pick on the Muslims. So we're going to include religious tolerance. And we're going to include, to the point where even if every single one of these steps is a good step, and even if good people should not need laws to agree with any of this stuff, we made laws to deal with this stuff. What we've done is we've moved people's room to move in their business, or in their hiring, or in their building their new building at the college, whatever it is you want to do, you're reducing their actual room to move, okay? So, you have to cover everybody. Let's make sure we cover diabetes. Well, we filled in that parking spot. Let's make sure we cover multiple sclerosis. You know, because somebody's going to try and wall these off. Let's make sure we cover HGH for short kids. Let's make sure, right? You start, this is where I can see the danger coming in, is you start making it harder and harder and harder for these guys to work. And at some point, I wouldn't be surprised at all if some of these guys say we're not going to do it. All right, Chris, last word, because we're over time.
I see where the doctors would have a problem with it when you talk about they're trying to make it, the idealistic part of this is that the insurance companies will lower their prices. Well, if the insurance companies lower their prices, they have to negotiate a price with the people that they pay, being the doctors, etc. So therefore, you have to lower their wage, which is not happening.
Most doctors I bump into nowadays are already pretty bitter because the HMOs did that over the last 30 years. So that's already happened. Like that step's already in place. Just like we've already pushed half of the workforce to part-time. Will this accelerate it? Maybe. It's certainly feasible. Has it already happened? Yes, 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 yes. All right. Very good, everybody. Questions? Go ahead. Let me out. Thanks.